Okay, so this is about hepatitis C screening, and in the United States, the current practice and recommendation by different societies is to screen patients with hepatitis C if they have a risk for hepatitis C. That means if they had a blood transfusion before 1992, if they have a history of intravenous drug use, or if they have some other risk factor for hepatitis C, they should be screened. However, we know that this strategy has not been very effective. When you actually look at hepatitis C, individual potential hepatitis C patients that you could have in the population, less than 5% have been currently diagnosed with the current sort of what we call risk-based screening for hepatitis C. So we looked at an alternative for screening for hepatitis C, and the alternative was to focus screening in the cohort that has the highest prevalence of hepatitis C. And we call this cohort the birth cohort that has the baby boomers. So these are the individuals who were born between 1946 to 1970. And this is a group that will have the highest prevalence of hepatitis C. And using a Markov modeling, we basically showed that if you screen these individuals for over a 5-year period of time, all of them, then you actually could save about 60,000 deaths related to hepatitis C. You can reduce advanced liver disease by about 100,000 cases. Now, if you look at cost and benefit and cost effectiveness, of course this strategy will be more costly, but there is going to be a lot more benefit by reducing the cost associated with advanced liver disease, liver transplantation, and liver death. So in general, according to cost-effective analysis sort of threshold, this strategy is cost-effective at the threshold of $25,000 per quality of life, per quality adjusted life year saved. So it's a cost-effective approach. The diagnosis of hepatitis C is made by blood testing, obviously. So the same blood testing will be used either by risk-based screening or by what we call birth cohort. However, what this will do is not rely on patients' history to tell you, because a lot of these patients were infected in 1960s and they don't remember, or they don't consider themselves as high risk, or they don't want to talk about potential risks that happened years and years ago. So if you want to just remove that discussion and just focus on the individuals that have a high stress, then you focus on the group of individuals that have the potential highest yield when you do screening, and that would be the birth cohort screening.